We got an email just a couple days ago from Lynne. She emailed us through questions@askjoedimatteo.com. That's how you can email and get these questions answered. She said, will you please discuss how to be successful in losing weight and staying healthy with intermittent fasting? Should you count calories or just focus on eating non-processed food, or both? How long does it take to see results?
Yeah, that's a good question. I mean, that's something like at some point, if you've tried to diet yourself or you've helped somebody diet, or you and your friend are trying something new at the start of the new year or whatever, it's something I've definitely considered. But before I answer it, I would say I would challenge her.
Okay.
Just to ask yourself why exactly you're doing it. There's no doubt there's some papers out there that will show these benefits that are often overstated, changes in insulin that seem meaningful. There's people like to mention like the mental acuity changes that they've noticed. Who knows? There's stuff out there that shows that it definitely does work for people. So whatever ultimately can allow you to be compliant is the most important part. So if she feels that this is her ticket to compliance and sticking with the diet long term, sticking to dietary changes long term, not just a diet, then more power to her. But what I will say is, again, these benefits are often overstated. A lot of times the benefits that people do get from intermittent fasting are just because of the fact that they ended up in a calorie deficit. So in her context specifically, she's looking to lose some weight. Mm-hmm. Intermittent fasting in and of itself is not going to cause her to lose any more weight than if she subscribed to another dietary pattern that had, let's just say, the calories, the amount of calories equated.
Yeah, that's what I was going to ask you, what you thought about that. Because then there's like the second layer to it is not just what's intermittent fasting going to bring relative to me eating less calories. You're saying that's the primary benefit.
Definitely.
So you don't ascribe much benefit to the actual intermittent fasting itself, independent of calories in, calories out.
Definitely. Okay. Definitely. And it's tough because we could look up a paper right now that talks about some of the hormonal changes that occur. But in the most elementary way, these like little acute changes in insulin and glucose right after this meal and what happens in between meals if you waited this long, the sort of the minutia of that sort of stuff doesn't often we don't end up seeing like long-term outcomes and benefits from that kind of stuff. Like we don't often see people who have sustained their weight loss for 5 and 10 years beyond that. We don't see people who've continued to lose weight, 5 and 10 years beyond that. It's, as we've talked about in other episodes, it's such a complicated aspect to maintain weight, to try to, achieve weight loss and then maintain it.
And what you said though, I think makes a lot of sense. What's going to allow you to, how did you say it? To comply? Maintain
compliance.
Yes. What's going to keep you on track? That's the most important thing.
Yeah. And so my most empathetic, response to her would be, if you want to do it, you should do it. There's no stopping you in doing so. It's, again, just being realistic about what some of the purported benefits are. So to go a step further, if we look at from what I gathered, the middle part of that question, should she count calories? Should she just focus on,
eating
less processed food,
that sort of
that sort of stuff. That just shows me right there that she's absolutely, her head's in the right place with this process. She's figuring this out on her own, and I like that. She's got to feel like she's steering the cart. Yeah. So in answering that, I would say that calorie counting should be viewed as the tip of the iceberg, like the tip of the pyramid, let's say.
Okay.
That's a behavior that I think that it's taken me a while to even undo this way of thinking.
Yeah.
We should work towards that. We should eventually become familiar with the practice of counting calories just to be comfortable with what's on food labels or, the macronutrient content of certain meats. But let's work towards that. By intermittent fasting, she's obviously taking on a big lifestyle change. That's big.
Big one.
You're changing she may have been eating every 2 or 3 hours before that, or every 4 hours.
Yeah.
Now she's doing the 16-8 thing.
Yeah.
I mean, that's a big change. And so I'm not about adding multiple big changes to somebody's plate. So focus on the new timing window. for a few weeks. See how that goes. See what happens to your weight. Weigh yourself daily or every other day for a few weeks. See how it's going. Once you're comfortable there, keep the focus on the unprocessed foods. Buy foods that don't have, 5 and 10 ingredients in them. Buy the stuff that you have to cut. Buy the stuff that you have to cook, and begin to minimize the ultra processed stuff. That in and of itself is going to take a lot of her mental, emotional, physical time.
Yeah.
Her bucket's going to be filled with this new change. And then beyond there, if you're still feeling pretty good,
right,
buy a kitchen scale.
Yeah.
Start weighing your meat. See how that, see how that maybe changes the weight gain or the weight loss that you've noticed. Weigh the vegetables. Weigh the oils that you're adding to the vegetables. But again, view that as a behavior to work towards. Whereas before, I thought if I wanted to lose weight or change my physique or gain weight, that I had to start there.
Yeah.
But that's where you see so many people burn out.
Yeah.
I've burnt out there 100 times. Work towards that practice. Use it to check in. Use it to educate yourself. But don't put too much stock in it. Just use that as something that once you're comfortable, you can kind of come back to from.
And for the people that don't know, intermittent fasting is...
You basically wait until, you basically stop eating after 6 or 7.
Right.
And then after lunch.
Yeah, you wait until a late lunch.
Yes, ideally. A late lunch, then you pack in the calories. And so in theory, for somebody just starting to do that, man, it's going to be, if you were eating 3,500 calories, let's say before that, by reducing
that window,
you're going to be hard pressed unless you buy 4 Big Macs to get that amount of calories. So it's clear how it begins to help somebody.
Right. Because that's the thing is most people you're going to feel satiated at X point, and it doesn't matter that you haven't eaten for 10 hours prior. You'll feel full after that first Big Mac. You don't need to try a second one to try and hit some calorie number. You're going to reduce calorie intake just by virtue of the fact that you'll feel full.
Yeah, I think she's just got to view this as just a learning experience for sure.
You said how long should it take to see results? And you said check in every day. And what are we looking at? Like an arc? We're looking for some general progress over the course of a couple of weeks?
Sure. Yeah, that's always a tough one. I think, using the mirror is always kind of it's kind of like your surefire way to
sure.
know if you're seeing some results. That's an easy way. Especially if she's going to be, let's just say she's doing more resistance training. She's probably going to add some muscle then. And so the scale might be discouraging.
Right.
If she begins to add a little bit more muscle,
right.
She thinks she's adding more weight. When you become too married then to the numbers on the scale, that can be a bit troublesome. So use the scale daily to build a baseline.
Okay.
Track those changes. And then I would probably just average your weekly weights. Depending on where you're starting from, realistically, you could safely lose like 1 to 2 pounds per week.
Okay.
So in theory, like the classic, if you're counting calories, it's like, yeah, you just be at a deficit of 500 calories a day times 7 days. That's 3,500 calories. 3,500 calories is a pound of body weight. It's that's like the most technical, like your body is a machine kind of way to look at things.
Yeah.
But yeah, safely, if you're losing 1 pound to 2 per week, and you're coming from maybe somewhere that you're sitting in the overweight range, that should be fine. Cool. And then eventually you might hit a point of a sticking point. Yeah. And at that point, you would probably want to add some calories back, reacclimate, and then you can kind of start that descent again. So this is such a long-term sort of picture.
Yeah. Okay.
So she should start, see what happens, track some of those changes over a few weeks to a few months, see what she learns. And then honestly, I wouldn't even be surprised if the intermittent fasting thing just kind of, she did like a less extreme version. Yeah. Instead of 16/8, she's okay doing 12.
Yeah.
And then it kind of works its way back into an every 5 to 6 hour meal. I'm all for it. Just try it, see what happens.